This is Achilles drill when any sources get simplified. Today I'll walk you through some common steeplechase questions associated with the anatomy of the upper limb. We'll talk about the osteology as well as the muscles. In fact, we'll also mention the innervation to those muscles as well. It's going to be a lovely session. Make sure you stick with me to the end. Alright, let's get straight to business now. Taking a look at my first structure right here. If I'm to ask you what structure this is, can you guess what structure it is? Yeah, this is the scapula. Okay, and on the scapula, a number of structures can be painted, and you'll be asked to identify what part that is, or you'll be asked to identify any structure attaching to the part painted. Okay, so let me get you a nicer picture. This picture is showing the posterior part of the scapula. We're looking at the scapula from behind, while the picture right here is showing the anterior surface of the scapula, looking at the scapula from in front. Okay, so let me take it to another picture. Now I would like to start with this part, the borders of the scapula. Okay, so sometimes along this edge right here, this part can be painted in steeplechase, and you'll be asked to identify what part this is. Well, this is the medial border of the scapula. The medial border, the part close to the midline. If you can take a look at the picture right here, this is the medial border. Okay, now the one on top, this line right here, is the superior border of the scapula. Okay, and of course the one inferior right here is the inferior. I meant the lateral, the one lateral right here is the lateral border of the scapula. Okay, so but I really want to emphasize on the medial border, because the medial border, some muscles are known to insert on it. Okay, so the medial border is very important. It can be painted for you to identify it, medial border of the scapula, or you'll be asked what structures, and you may mention two muscles inserting on the part painted, and the rhomboid muscles are said to insert on the medial border of the scapula. Okay, so here is the medial border of the scapula. Of course, you can see the rhomboid major muscle taking origin from there. Okay, as a matter of fact, the rhomboid minor too, they are also attaching right there to the medial border of the scapula. Okay, let's move on now and talk about the fossas around the posterior part of the scapula. Okay, so there is a very small fossa in here, this small fossa within this superior part of the scapula. That fossa is called the supraspinous fossa. Okay, before I move on, let me just draw your attention to this ridge of bone right here. This ridge of bone starting from here and going up is the spine of the scapula. Okay, although we'll get it, that's the spine of the scapula, and it is dividing the posterior part of the scapula into the supraspinous fossa on top and then the infraspinous fossa beneath. So any of these fossa can be shaded in steeplechase, and you'll be asked to identify any muscle inserting or originating from there. Okay, so and the supraspinous fossa is associated with the muscle supraspinatus. Okay, the supraspinatus muscle takes its origin from the supraspinous fossa, while from the infraspinous fossa we have the infraspinatus muscle taking origin from there. I have a very nice picture of that. Okay, so this picture is showing the supraspinatus muscle originating from the supraspinous fossa, and of course the infraspinatus muscle originating from the infraspinous fossa. All right, so these muscles are very important. As a matter of fact, you could be asked to, the muscle themselves could be pinned in steeplechase, and they are easy to recognize. Once you can see any muscle attached to the posterior part of the scapula above the spine, it's most likely the supraspinatus. And if it is beneath the spine right here, then it will be the infraspinatus. Another question could be, what is the innervation to the muscle? Supraspinatus might be pinned, the infraspinatus. The innervation is from the suprascapular nerve. Okay, both of them are innervated by the suprascapular nerve. Alright, very fast, let me draw your attention to the angles of the scapula too. Okay, the angles of the scapula. Here is the superior angle of the scapula. This structure right here is the superior angle of the scapula, and then down here too we have the inferior angle of the scapula. And some muscles too are known to take origin from this part. For example, the superior angle right there, the levator scapulae muscle inserts on it. Okay, let me show you a picture of that. Are you seeing the levator scapulae muscle right here? This muscle is a levator scapulae muscle, is involved in elevating the scapula. Okay, so and it is inserting on the superior angle of the scapula. Okay, so if the superior angle is painted and you are asked to identify a structure attaching to it, very simple, levator scapula. And coming down, we also have the inferior angle, right? The inferior angle, there is also one very important muscle that takes origin from there, right there. So that muscle is the teres major. Okay, teres major. And here is a picture of teres major. You can see teres major right here. Teres major is taking origin from the inferior angle of the scapula, right? So note all those structures. And teres major too can be painted, it can be pinned in steeplechase. You have to identify the muscle and you must be able to differentiate it from teres minor. Teres minor arises from a large part, from the bulk of the infraspinous fossa, but teres major, it arises just from the angle, just from the inferior angle. Okay, so if any muscle in the posterior scapula is pinned in steeplechase, just identify the origin. Teres major is just from the inferior angle. Alright, so let's move on now and talk about the spine of the scapula. Okay, the spine of the scapula is this region right here, just as I pointed, arising from the medial part of the scapula, going up and then continue as this acromion process. It continues as the acromion process. Well, I want to draw your attention to something now. Understand that the scapula runs from thoracic vertebra to this part right here. The superior angle corresponds to T2, superior angle, it corresponds to T2, while the inferior angle corresponds to T7. Okay, so the scapula is said to run from T2 to T7. Now understand that the spine of the scapula is associated with the T3 vertebra. Okay, so sometimes the spine of the scapula will be painted and you'll be asked to identify the landmark for it. So it is associated with the third thoracic vertebra. So let's move on now and talk about some important muscles taking origin or inserting on the spine of the scapula, otherwise called the scapular spine. So, and there are two of them, two very important muscles, trapezius and deltoid muscle. Okay, so this very large sheet of muscle right there, this muscle is a trapezius, and you can see trapezium is inserting on the spine of the scapula right there, the part I'm painting green, that's the spine of the scapula. So trapezius is a very important muscle inserting right there. Then we also have this large triangular muscle called the deltoid. The deltoid is one very important muscle inserting on the spine of the scapula as well. Okay, so we've mentioned two very important muscles inserting on the spine of the scapula, trapezius and deltoid muscle. Okay, the innervation to the deltoid muscle is by the axillary nerve. Okay, axillary nerve, very important. The deltoid muscle can be pinned in steeplechase. You will recognize it is a very large and superficial muscle in the shoulder joint. Okay, so it's right there, and the innervation to it is by the axillary nerve. However, the innervation to the trapezius muscle is from the spinal accessory nerve is a very important cranial nerve as well. Okay, the spinal accessory nerve. Alright, and that should be cranial nerve number 11. Okay, let's move on now to our next model. That should be the acromion. Let's talk about the acromion right there. I told you the acromion is a continuation of the spine of the scapula. It continues anteriorly. So let's look at the anterior part of the scapula. Let's have a view, an anterior view of it. Okay, are you seeing the acromion coming out and projecting right there, coming from behind and coming to the front. Don't confuse it with the coracoid process. The coracoid process is a finger-like structure, more like a bent finger. It points away from you. The coracoid process points away from you. But acromion process, it points towards you when you're looking at the scapula from in front. Okay, so acromion process is associated with the clavicle. It attaches to the clavicle. There is a joint right there called the acromioclavicular joint. Let me show you. Okay, so are you seeing the acromion? The acromion articulates with the acromia end of the clavicle, and a very important joint is formed right there, the acromioclavicular joint. Although some ligaments too originate from the inferior part of the acromion, some important ligaments too. We have the coracoacromial ligament originating from the inferior part of the acromion and inserting to the coracoid process. So that's that about that. Now let's talk about the coracoid process itself. The coracoid process is also one very important part on the scapula, and a number of steeplechase questions can be thrown at you if that part is painted. The most common will be, what is the structure? Coracoid process, of course. Another question could be, mention 2 muscles or 3 muscles inserting on the part painted. You have to understand that the coracoid process is a very important structure for muscle attachment. About 3 muscles attached to it, attaches to the coracoid process. Here is the short head of the biceps. Okay, here is the bicep, and it has 2 heads. Of course, there is a long head and a short head. Understand that the short head of the bicep goes all the way to the coracoid process to insert. Okay, then there is also this very important muscle too, the coracobrachialis. This green right here, that green muscle is deep to the biceps brachii. Okay, and lastly we have the pectoralis minor. Right here it is grayed out, but I'm encircling it triangle right there. Okay, so that muscle is the pectoralis minor, of course, and it's also inserting on the coracoid process. So we mentioned 3 muscles associated with the coracoid process right there. Understand too that these muscles right there, coracoid process itself or the bicep brachii, they can be pinned to in steeplechase. All you have to do is to just trace their insertion. For example, coracobrachialis, it is always obvious. It will be deep to the bicep brachii, it will be deep to it, that is underneath it, and then it will also be inserting on the coracoid process. But for the biceps brachii, you will see the continuation, that it is continuing as a fusiform muscle with it's forming it's joining with the other head, the long head. So it's more of, it has 2 heads. Okay, but for the coracobrachialis, it's just a single muscle. So once you can know those differences, you are good to go. You won't confuse which muscle they are, and understand that the innervation to these muscles, anterior muscles or anterior muscles of the arm, they are innervated by the musculocutaneous nerve. Okay, so if biceps brachii is pinned, what is the innervation to it? Musculocutaneous nerve. Coracobrachialis, musculocutaneous nerve. Even the brachialis muscle too. Brachialis muscle is one very important flexor muscle right there too. It's also innervated by the musculocutaneous nerve. Please note all those. Alright, very fast, let's talk about this anterior fossa right there. This very large fossa on the anterior surface of the scapula. That fossa is called the subscapular fossa. Okay, the subscapular fossa. And funny enough, it can be shaded too, and you'll be asked to identify one muscle, one important muscle taking origin from there. That muscle is the subscapularis. Okay, although it's not written, I have a picture of it. Subscapularis takes its origin from the subscapular fossa. Okay, so this is it in green right there. This muscle is the subscapularis muscle, and it is a very important internal rotator of the shoulder joint. Okay, it internally or medially rotates the shoulder joint compared to the infraspinators and teres minor behind. Those ones are very important external rotators. Okay, so subscapularis is an internal rotator. Very fast, let's talk about the lateral parts of the scapula, that is the glenoid cavity of the scapula, because that's where the head of the humerus inserts on. Okay, this cavity right there is the glenoid cavity, and it is associated with the head of the humerus. Okay, so that's the glenoid cavity. And then the superior edge of this glenoid cavity, there is a very important tubercle right there. That's the supraglenoid tubercle. And then inferior to also have one important tubercle, the infraglenoid tubercle. I have a better picture of that. Alright, so there's a picture from Teach Me Anatomy, and you can see the supraglenoid tubercle right there. That very important tubercle. And then inferior here too, we have the infraglenoid tubercle. So let's move on to a very important structure now, the clavicle. Yeah, okay, this is a very important bone in the upper limb, forming the pectoral girdle. Okay, understand that it has two ends. There is the medial end right here. The medial end is quadrangular in shape, kind of just triangular. It's right there, but the lateral end is flattened. Okay, the lateral end is flat, so you have to be able to recognize this part. Okay, so here's another picture. Can you see the lateral or the acromion end of the clavicle? And then medially here we have the sternal end, the sternal or the medial end of the clavicle. So those parts too can be painted, and you'll be asked to identify what they articulate with. So of course the sternal end, which is the triangular part, kind of is not flattened. You see it right there. It articulates with the manubrium of the sternum, but the lateral end, this flattened part, this one is said to be flattened. It articulates with the acromion process of the scapula. So note all those. Let's move on now and talk about the inferior aspect of this clavicle. Inferior aspect too is roughened with a number of tuberosities, tubercles, and their insertion point for very important ligaments. Okay, two very important one I would like to draw your attention to is the conoid tubercle. Okay, on the lateral end of the acromion end of the clavicle, of course, there are two tubercles inferior. There is a conoid tubercle right there, and then there is the trapezoid line. Okay, the trapezoid line is right there, and some important ligament, the coracoclavicular ligaments, they insert to these important tubercles. Okay, so don't forget it is on the lateral part. So you can see it again, flattened end, acromion end, quadrangular end, which is the sternal end. Okay, let's move on to another important bone. Can you guess what bone is? What bone is this? Yeah, this is the humerus. Okay, the humerus is a very important bone of the upper limb, and it is the longest bone in the upper limb as well. Okay, so we'll talk about the proximal part first. We'll be interested more in the proximal part, that is from here upwards. Okay, let's emphasize on this region right there, the proximal part of the humerus. Okay, right there, let's take it step by step. The first thing I want to draw your attention to is the head of the humerus. This region right there is the head of the humerus. Ignore my pen, please. Okay, just bear with me. So that structure is the head of the humerus. And one important question could be the structure right here painted. For example, if the head is painted, is articulating with what? Can you guess? Yeah, it is articulating with the glenoid cavity of the scapula. Yeah, we mentioned it that time. That's where the head of the humerus inserts to. Another structure I want to draw your attention to is the neck around the proximal part. There are two necks, in fact. Okay, so the first one is the anatomical neck right there. The anatomical neck separates the head of the humerus from the greater and lesser tuberosity. We'll get there. But I want to draw your attention to this very important surgical neck as well. So the humerus has two necks. There is the anatomical neck right there, just at the inferior part of the head right there. And then there is this very important surgical neck. The surgical neck, you have to be able to understand one important structure related with it. So sometimes the surgical neck can be tied in steeplechase and you'll be asked to identify one important nerve closely associated with the surgical nerve, so with the surgical neck. That nerve is the axillary nerve. Okay, the axillary nerve is closely related to the surgical neck of the humerus, not anatomical neck, please. The surgical neck of the humerus, right? So now let's talk about the tubercles at the proximal part of the humerus. Of course, we have the greater tubercle, which is the larger and the lateral one, and then we have the lesser tubercle, which is the medial and the smaller one. Okay, so the structures to a number of muscles insert on them. For example, now the greater tubercle has the supraspinatus, infraspinatus, and teres minor inserting to it, while the lesser tubercle in front, it has the subscapularis, that muscle we mentioned originated from the subscapular fossa. We have it inserting to the lesser tubercle. Okay, let me show you a picture of some of the muscles inserting on it. Okay, so of course, here is the greater and lesser tubercle. Okay, now you can see some set of muscles inserting on the greater tubercle. So some muscles on the posterior scapula, supraspinatus, infraspinatus, and then teres minor. Those three muscles right there, they are labeled right there. They insert where? On the greater tubercle of the humerus, while the lesser tubercle is associated with the subscapularis. Okay, so here is a picture of it. Subscapularis originating from the subscapular fossa and finally inserting where? Inserting into the lesser tubercle. Okay, I also want to draw your attention to a very important groove between the two tubercles. That groove is called the intertubercular groove. Are you seeing where I'm circling? Intertubercle, between the tubercles. Okay, it's otherwise called the intertubercular sulcus too, and it is closely associated with the long head of the bicep. The long head of the bicep passes within this intertubercular groove. As a matter of fact, some important muscles to insert into it. You talk about the teres major, not minor, teres major muscle, and even the latissimus dorsi. Those muscles insert into the intertubercular groove. Okay, let's move on now and talk about the shaft of the humerus. Okay, so two structures are important on the shaft of the humerus. There is this roughened edge right here. That roughened edge is called the deltoid tuberosity, the deltoid tuberosity of the humerus, and that's where the deltoid muscle inserts on. Okay, are we seeing the deltoid muscle right there? Of course, the triangular muscle is the deltoid muscle, and it is inserting on the deltoid tuberosity of the humerus. Okay, and also there is a very important groove too on the posterior part of the humerus, a shallow groove. That groove is closely associated with the radial nerve, so that part too can be painted in steeplechase. A spiral groove will just be highlighted and you'll be asked to identify a very important structure associated with it. So the answer is the radial nerve. Okay, so and that's that about that. Now let's come down to the distal end of the humerus. Okay, the distal end of the humerus is one very important part. So we'll take it step by step now, starting first with the anterior surface. Okay, the anterior part. Okay, we're looking at the humerus from in front now. All right, so two structures I want to draw your attention to. The first is the trochlea of the humerus. Okay, this structure right here is the trochlea of the humerus, and it inserts into the tracheal notch of the ulna. I'll go over it again. The structure itself is the trochlea of the humerus, but it is inserting into the tracheal notch of the ulna. Okay, and then laterally we have the capitulum. The capitulum is another structure on the distal end of the humerus. It is associating or inserting to the head of the radius. Okay, so note those structures. Let me show you a picture of the trochlear notch. Alright, so here is the ulna, this is the ulnar bone, and there is this important notch right there. that notch is called the trochlear notch, and that's where the trochlear process or the trochlea of the humerus, that's where it inserts to. Okay, very fast too, I want to draw your attention to this groove on top of the trochlea. That groove right there is called coronoid fossa. Okay, the coronoid fossa is very important. As a matter of fact, the coronoid process of the ulna, it inserts into the coronoid fossa during flexion. Let me show you the coronoid process of the ulna. This anterior projection right there, this anterior projection is the coronoid process of the ulna, and during flexion it inserts into this groove right there. This groove is the coronoid fossa. Okay, and also lateral to the coronoid fossa we have the radial fossa, a very much shallow fossa right there. Okay, and it accommodates the head of the radius during flexion as well. Okay, let's move on now and talk about the posterior aspects of the humerus. Don't forget, we're looking from in front now. This is the anterior. Now let's go to the back of the distal end of the humerus. One very important fossa I would like to draw your attention to is the olecranon fossa. The olecranon fossa accommodates the olecranon process of the ulna. I'll still show you that again. Okay, here is a picture of the olecranon process of the ulna. Olecranon process of the ulna. It fits into the olecranon fossa of the humerus. Okay, so there's the fossa right there, and it is often painted in steeplechase. So you be asked to identify the fossa, which is olecranon fossa, or a structure inserting into it, which is what? The olecranon process of the ulna. Here is still another picture of the olecranon process of the ulna. Okay, so during extension, the olecranon process fits right there. Alright, so that's that about that. Here is a summary of everything, trochlear process, capitulum and all. Okay, lastly now let me draw your attention to the epicondyles and the supraepicondylar ridges. Okay, of course on the medial end we have the medial epicondyle of the humerus. On the lateral end we have the lateral epicondyle. But very important now, I want to draw your attention to the epicondylar ridges. Right here is called the medial supraepicondylar ridge, while on the lateral end here we have the lateral supraepicondylar ridge. They are very important points for muscle attachment. As a matter of fact, for the medial side, medial epicondyle and medial supraepicondylar ridge, it is the origin for the common flexors, the common flexor origin. Okay, while for the lateral end it is the common extensor origin. A number of muscles originate from the extensors of the extensor muscles of the forearm. They take origin from lateral epicondyle. Alright, let's move on to the radius. Before getting to the radius, let's talk about the ulna. Although we've mentioned the number of structures on the ulna. The ulna, this here is the proximal part of the ulna. Okay, so and the bone is right here. So for the proximal part, there are two structures I want to draw your attention to, three in fact. There is the trochlear notch, of course, we've mentioned that important notch. That's where the trochlear process or the trochlea of the humerus, that's where it inserts to. And then we have the olecranon process, which is the one protruding up, the superior process. Okay, and of course the one pointing to you is the coronoid process. We've mentioned all those, but very important, I want to draw your attention to one tuberosity. Okay, a tuberosity called the ulnar tuberosity. Okay, I think here is a better picture. Are you seeing this tuberosity right there? That tuberosity is the ulnar tuberosity, and it can be painted in steeplechase, and you have to identify one important muscle inserting to it, and that muscle is the brachialis muscle. Okay, brachialis muscle inserts into the ulnar tuberosity. Are we seeing it? The brachialis muscle is a very important flexor of the elbow joint. Okay, and it is innervated by the musculocutaneous nerve as well. That's the insertion right there into the ulnar tuberosity. Okay, so Lastly, the distal end of the ulna, we have the styloid process right there. The styloid process is on the distal end, just around the head of the ulna as well. The head of the ulna is still this distal part, and just medial to it is the styloid process. Okay, let me also draw your attention to the shaft. Along the shaft of the ulna, this lateral edge can be painted, and you'll be asked to identify one important structure inserting to it. Can you guess what structure that is? Yeah, the interosseous membrane. The interosseous membrane is right there. Interosseous membrane. Alright, so straightway to the radius now. The radius is this bone right here, of course, the lateral bone of the forearm. Okay, it has a head. Obviously, here is the head. And can you guess where the head is inserting to? We've mentioned it today. Yeah, the capitulum of the humerus, the capitulum. That's where the head articulates with. Okay, and of course, there is a neck too. The neck is a constriction right there. So very, very important. I want to draw your attention to this tuberosity right there. That tuberosity is the radial tuberosity. I have a vector picture. Here is the head, of course, the head, the neck, and then the radial tuberosity. And it is the insertion point for the biceps brachii muscle. Ulnar tuberosity is the insertion point for brachialis muscle. Any of them, if they are painted, please note it. While radial tuberosity is the insertion point for the biceps brachii muscle. I have a picture of that. Okay, there is a very, very large fusiform muscle. And you can see the insertion into the radial tuberosity of the radius. So, and of course, don't forget the muscle itself can be pained. The muscle bicep brachii can be pained. And what's the innervation to it? Can you remind me? Yeah, the musculocutaneous nerve. And what important structure is inserting on ulnar tuberosity? The brachialis muscle. You are doing very well. Alright, so and that's actually the end of this lecture. Thank you very much for tuning into my channel. If you find the video helpful, do it to hit the like button and also subscribe. When you subscribe to my channel, you will have access to a number of videos designed just for you to nail success. Thank you very much.